For the first time, the United States Preventative Services Task Force is now recommending children as young as 8 be screened regularly for anxiety. It cited a 2018 to 2019 national survey of children's health that found 7.8% of children and adolescents aged 3 to 17 years had an anxiety disorder. Usually characterized by fear or excessive worrying, anxiety can go undetected for a long time in kids. Let's talk about this with Jeff Gardier. He's a clinical psychologist and associate professor at Touro College of Osteopathic Medicine. Jeff, it's good to see you. This feels like an important revelation. Why now? It seems there's a sense of urgency to this.
Well, I think a lot of this is coming from what we have experienced with COVID-19 and how we've seen that there have been increased rates of anxiety, depression, PTSD, emergency visits to pediatric emergency rooms for kids. So it's really important that we pay attention to the fact that it's not just about academic development that we're looking at for our children, Anna, but also what is their social and emotional development, and knowing that if you're diagnosed with anxiety as an adolescent or a teen, that you have an increased chance as an adult of having an anxiety disorder or depression.
So is this a reflection of a growing problem among adolescents or youth, or is it just growing awareness?
I think it is certainly a combination of both, because what this task force is saying is that this isn't just about COVID. It's also about genetics. It's also about the environment. It's also about the stress that children are going through. I think for a very long time, and a great question that you ask, yes, it is about the awareness. It is about growing statistics, but it's also about the reality that, yes, even children can have mental health issues. They can be diagnosed with anxiety and depression at younger ages. And we tended to think that these are things that we only look at with kids when they go from their teens to their adult years. So yes, if we can diagnose earlier on, then certainly what we're looking at is a better outcome if they do actually get the proper treatment.
So if we're talking about children as young as 8, that's the recommendation. Go get a screening for those kids.
Correct.
Why do you think that age group is the place to start? And what exactly does a screening entail?
Well, they're not totally clear on that. There is something that we use as psychologists and psychiatrists, social workers, called the GAD-7. That's a generalized anxiety, depression sort of screening. But this is a screening that we see that has moderate just to screen the child, not necessarily that particular screening, but screening for anxiety from the ages of 8 to 18, we see has moderate benefits because we see that the treatment may perhaps work better and there are less deleterious effects when we look at psychotherapy, when we look at the pharmacology of treating in that particular way. So they do feel that the ages from 8 to 18, the data that we've reviewed really gives us the best results.
What do we as parents need to look out for? How can we tell the difference between a child who's sometimes stressed, sometimes anxious, which I guess would be normal, right, versus when it's a real issue that may need some professional help?
Yeah, so we have to look at a lot of the very obvious signs as well as the subtle signs, because younger children may not have the perhaps maturity or even the language to say that they are anxious or even can recognize that anxiety, so they act out. So it's important to look at whether they're isolated. It's important to look at whether they're losing interest in some of the activities that they in the past actually enjoyed. Whether they're very nervous around other people, some of that social anxiety that we see, and physically, how are they behaving? Are they nervous enough that their hands are shaking, or that perhaps they're having nightmares or not eating properly or interacting with others? So those are all very subtle and sometimes obvious signs, Anna.
Jeff Gardier, great to have you here. Thanks so much.